Yeah.
I'm student nurse Joe Fed, and I was assigned to you today. Is it okay if I shadow you?
Sure.
And are you getting ready to give medication?
I am. I'm getting ready to go in and see a patient and give some insulin.
Is it all right if I get an S-bar from you on the patient?
You sure can. We're about to go in and see Mr. Greg Lutz. He's a 67-year-old male. He's a full coat. He's 5'11", 171 pounds. According to his chart, he has no known allergies, but we'll double-check with him when we go in there. He was admitted a couple days ago from the doctor's office to the emergency room, complaining of a sore on his heel that's getting worse, and also he's a diabetic type 1 times 20 years, and for the past couple of days his blood sugar has been consistently over 300. So we want to check on his stage 2 ulcer that he's had for about 3 weeks, and also see about his blood sugar. Along with diabetes, he also has a history of hypertension and high cholesterol.
Okay.
Right now, he's A&O times 4. He does wear glasses. He has severe visual impairment. He does drink weekly. According to him, 1 beer once a week when he goes bowling. He's a non-smoker, and he is ambulatory. He does have sensory deficit to his lower extremities because of his diabetic neuropathy. All his other vitals seem within normal limits, and he is on a diabetic diet as well. He does have a peripheral IV in his right median vein, and like I had said before, he does have the ulcer, diabetic ulcer on his lateral aspect of his right heel.
Okay.
He was admitted for glucose control, pain management, and diabetic teaching, and also to have an evaluation of his wound.
Oh, okay. So you mentioned that he was getting insulin, so why specifically is this client receiving that medication?
That's because of his type 1 diabetes. Since it's type 1, his body does not produce insulin, so it must be augmented with medication, insulin injections.
Okay. What's the action of this medication on the body?
The insulin facilitates glucose, amino acids, and potassium to actually enter the cells. So it's like a key in a lock.
Okay.
So it allows the glucose in, especially with muscle cells and adipose tissue.
Oh, that's a good analogy. When should you question administering this medication?
Well, the number one thing we're concerned about is his glucose levels. So if his glucose levels are low, then we would hold the medication. So if his glucose was below 60, we would definitely hold the medication.
Okay. Does this medication have a therapeutic serum level?
No, it does not. What we're trying to aim for is a glucose range between 60 and 100, 70, 110, about there.
Okay. And which vital signs should be monitored?
We're going to monitor all his vital signs, but specifically we're going to look at signs and symptoms of hypoglycemia, which could be tachycardia. So we're going to check his pulse rate, going to check his skin temperature, want to make sure he's not cold and clammy. Those are hallmark signs of hypoglycemia.
Okay. And which physiological parameters should be monitored when the medication is being administered?
Again, those signs and symptoms of hypoglycemia. You know, we want to make sure that he's not trembling, not shaky. There's no confusion. It's not tachycardic. You know, he has even respirations, no palpitations.
Okay.
So.
And what interventions must be taught to the client to ensure the medication is administered safely in a hospital setting?
In the hospital setting, we're going to do some of the diabetic teaching, make sure that the client knows what he's getting, what it's for, when he's supposed to have it. Also, want to make sure that he understands all the medications he's getting, especially in the hospital setting, and also for when he's discharged to home. That way, that's another way to prevent medication errors. If he knows that he's supposed to get it, then he can kind of sign off on it. If he's not aware that he's supposed to get it, then he can question and can raise a red flag for us.
All right, speaking of him being discharged home, what interventions must be taught for taking the medication safely at home?
Well, we'd like to make sure that he's injecting it correctly because he has a history of high glucose readings.
Mhm.
We want to verify that he's accurately measuring it, if he's doing it injections as we're going to be doing, or if he's using a pen. He does have visual problems with eyeglasses, so we want to make sure that he's able to measure it up correctly, and also that he's taught about where to inject it and how to clean the site.
Okay. What are the side effects and potential adverse reactions with this medication?
Side effects and adverse effects, of course, would go back to the hypoglycemia, the signs and symptoms of that. Since he's been diabetic for 20 years, there's little chance of allergic reactions, but we also want to watch out for that, especially severe allergic reactions such as anaphylaxis, which is systemic, and that's life-threatening.
Right. And how will you know the medication is effective?
Well, he has an order for his blood sugar to be checked 4 times a day. So we're going to have the blood sugar checked after he gets this medication. He's getting a short-acting medication and a basal NPH medication, so that's more of a long-term coverage. So we'll have his blood sugar checked in about an hour after he's given it to see if it's trending down back to normal levels. His was up until a few days ago in the 120s, so that's would be aiming for something below the 120 range.
Okay. Those are all the questions I have right now.
Okay. Well, let's go ahead in and see Mr. Lutz.
Okay.
Come in.
Hi, Mr. Lutz. How are you today?
I'm good. How are you?
Okay, my name's Richard. I'll be your nurse. And I have Joe here. He's a level 1 student, and he's going to be shadowing me. Is it okay if he watches?
Yeah, that'll be all right.
Thank you,
Okay.
Mr. Lutz.
Okay, great. Before we start, if I could just have you give me your full name.
Sure. Greg Lutz,
Okay, and your age.
67 years old. You
Okay.
can believe that.
Okay, wonderful. No, you don't look it. Can I ask you if you have any allergies?
Nope.
No allergies?
No allergies.
Okay, wonderful. Now, you've been diabetic for about 20 years now?
Yeah, that sounds about right.
Okay. And it looks like we took a blood sugar, that was about half an hour ago, and it was 242.
Holy cannoli, it was that high?
Yes, it was. So we're going to be giving you some insulin to help bring that down, okay?
Okay, I think that sounds good.
Okay, wonderful. Now, when you were at home, where do you normally inject your insulin?
In my abdomen.
In your abdomen? Okay, where was the last time you injected it? Do you know which area of the
It was
abdomen?
right about here on the left side.
On the left side? Okay, so we're going to go ahead and do it on the right side this time.
Okay.
It's good when you're home to do like a checkerboard pattern.
Okay.
So if you keep alternating the spots, it keeps scar tissue from building up, and that can affect the absorption of the insulin.
Oh, I didn't know that.
Yes. And also when you're giving it at home, do you clean it with anything?
With soap and water.
Okay, wonderful. That's perfect. Okay, I'm going to go ahead and pull up his insulins. Like he's getting NPH insulin. He's also getting regular insulin. Okay. When I pull these up, I want to check the expiration date too, okay? Make
Okay.
sure they're good. They're usually good for about a month.
Okay. Now, MPH is cloudy, correct?
That is. So that's actually a suspension. So what we want to do is we want to make sure that we roll it, and that resuspends it. Otherwise, we're not going to get the right amount of insulin.
Okay.
going
That makes
forward.
sense.
Okay. Okay. Mr. Lutz, can I have you give me your full name and your date of birth, or your age again?
Sure. Greg Lutz, 67 years old.
Okay. Wonderful. Okay. Great.
Okay. You have any questions for me?
No, not really.
Okay, let me scan this again. And when we're doing this, we're doing the 5 rights. If you've
Okay.
heard of those before,
Yeah.
we're making sure that we're getting the right medication,
Mm-hmm.
that we have the right patient,
Mm-hmm.
the right route, the right dose,
And the right time,
order,
right?
and the right time.
Yeah.
Correct. Yes.
So are you going to be here for long? Did you just get here?
Gonna be here for a while. So, did you have food ordered by chance?
I did.
Okay, how long ago did?
Oh, I don't remember. It's been a little bit.
A little bit. Okay,
Yeah.
so it should be coming soon, I would think. If you don't get it soon, let me know, definitely. Okay. This regular insulin starts to work in about 30 to 60 minutes, so we want to make sure that you get something to eat before then.
Okay.
Okay. Okay. Okay, so before you start pulling up any insulin out of the vials,
Mm-hmm.
you're going to want to clean the top.
Okay.
Clean it like you mean it. Heard that
Yeah,
one?
I've heard that several times.
Several times.
Is that something I should be doing at home?
Yes, if you're not using a premixed syringe or one of those pens, definitely want to be cleaning this on the top. Keeps bad germs away.
Okay.
Okay, so
Lets the good germs in, I guess.
don't want any germs coming in.
Got a joker.
Yeah. I'm going to go ahead and roll this one more time. Make sure it's suspended. Okay. Now, it looks like we were giving 16 units of the regular and 20 units of the NPH. So, 16 plus 20?
36.
36, okay. We'll go ahead and pull up 36 units of air.
Yeah, I got that.
Okay. And we do this so that we don't get a vacuum
Okay.
built up in
Yeah.
this. So 36, look good?
Yep, looks right
Okay.
on.
Okay. So what we'll do is we'll go ahead and put the air into the NPH first. Okay. Okay. And we'll put 16 into the regular. Flip it up. I'm going to pull up 16 units, and this is on a sliding scale because of his blood sugar.
Okay.
242, okay. We'll pull this up. We'll pull up a little bit more than 16.
Mm-hmm.
Bring it back down to 16. Make sure we get no air bubbles in there. Look, 16.
Looks good.
Okay. pull up the MPH, and pull up 20 of that, so we'll get a total of 36. 36?
Yep.
Okay, great. You've heard about the one-handed scoop technique too, right?
Absolutely. You don't want to stick yourself.
Exactly. Okay, there we go. Okay. Okay, now we're going to put this alcohol swab on here, okay?
Should I be
Clean it
doing
up.
that at home?
Soap and water is just fine when you're at home, okay?
Oh, okay.
Okay. And pinch it. Okay, so we're going to go in at a 90-degree angle. Okay. Shouldn't feel too much, but just a pinch. Stabilize. And then hold it for about 5 seconds. And right into the sharp center.
That wasn't too bad.
No, not too bad at all. Okay, so I have some information for you. Okay. This is about the diet you're on. Okay, this is just some samples of the 1,800 calorie diet.
Okay.
And the 2 grams of sodium. So it gives you some ideas about that. Okay. And this also is some more information on diabetes meal planning. Okay, and it gives you some options and also a place to record or plan future meals.
That'd be good.
Okay, that way it can keep you within the range for your diet. And that can also help with your the ulcer on your foot.
Okay.
It can help it heal. On that note, I think you have a consult for a wound care nurse to come in and take a look at that also. Okay?
All right.
Okay. Do you have any pain right now? in your foot?
No, not really.
No? What would you say it's at right now?
Probably about a 1.
A 1? Okay, so that morphine that I gave you earlier, that's still working.
Oh, yeah.
Okay, wonderful, wonderful. And here's the diabetes and foot care information.
Okay.
And I'll be in about an hour, unless you need anything from me right now.
No, I think I'm good.
Okay, wonderful. If you want to look that over, and if you have any questions when I come back, we can talk about it, okay?
Thanks, I appreciate it.
Okay.
Hi, Mr. Love.
Hi.
I have a few more questions, if you don't mind.
Sure, no problem.
Were there any pertinent pieces of information you received before administering the medication to the client?
It was his blood sugar level.
Uh-huh.
I wanted to make sure that we had an accurate blood sugar level, and I checked that twice to make sure it was 242, and with the sliding scale that we were given the correct amount of insulin.
And did this information affect the decision to administer the medication?
Oh, it definitely did. If it had been within a normal range, say 70 to 100, definitely would not have given it. If it had been over 400, we would have definitely called the MD on that one too.
Okay. And did this information affect how you administered the information, or the medication?
When he told me that he had given it in his lower left abdomen, that made me change position, so we didn't create the lipodystrophy.
Oh, okay. Well, that's all the questions I have. Thank you for letting me shadow you today.
Oh, you're very welcome.
All right, thanks.